come to Pete. Pete is the manager over the northern region for IU Health. And Pete's concerns were patient satisfaction, government reimbursement, accreditation compliance, and litigation defense. And what he said was all of that important stuff relied on this antiquated paper-based tray tracking process. And said he basically looked at it this way. He said, "Our goal is simple. We want to get our patients hot food hot and cold food cold and get the dirty trays out of there as soon as possible." And he said the issue was this simple process exposed us to so many areas of risk that we had to basically find a solution. And so he said, look, we were introduced to trays at DocumentMountain.com by the facilities manager who was actually using Document Mountain to streamline another process. And he said, in the dialogue with DocumentMountain.com, he said it again, we want to get hot food hot to the patients and cold food cold when it's supposed to be, and we want to get those dirty trays out of them. Because the bottom line is patients vote with their stomach. As patients would leave the hospital, they're queried. They have 5 different queries to them. And the query that would go on would basically be, the appearance of food, the taste of food, the quality of food, and the other 2 were there missing items and how nice were the people? So based off of those 5 questions, that information would go back to the government and would dictate the amount of government reimbursement that the hospital would give. And Pete, at the end of implementing our trays solution, said that we now have the ability to not only get 100% of our government reimbursement back, we're also be able to avoid any issues with not documented, not done during compliance audits, and also to have the peace of mind that they could defend themselves against any type of grievance.